Now, COVAX is the international scheme which aims to ensure that coronavirus vaccines are shared fairly among all nations, rich and poor. It brings together governments, manufacturers, scientists, civil society and philanthropy to provide a global solution to the pandemic. The COVAX scheme has secured 3.5 billion doses for middle and low-income countries. But so far, only 30.5 million doses have been supplied. Now, that's less than 1% of the total number of COVAX doses secured. Richer countries with stronger buying power have benefited and received the most vaccines. The US has, look at that, 115 million doses delivered in total. If we look at China, it's received 65 million and India 39 million. But let's compare that to the African countries who have received the most. Rwanda has just over 321,000, Ghana 300,000 and South Africa 177,000 in total. Now, on top of that supply problem, take a look at this. This is one of the most difficult roads the vaccines would have to travel down. Now, this is actually a delivery of another lot of medicine in South Sudan by an international development company. And as you can see, these roads are treacherous. Well, Fergus Drake is the CEO of a large non-profit company called Crown Agents. It's a UK-based in-country distributor of vaccines on behalf of COVAX. He explains which countries he's managed to deliver to.
Crown Agents has been involved in the COVID-19 response for over a year now. Firstly, we were involved in distributing personal protective equipment to over 50 countries and overseas territories on behalf of the British government. We've also now focused on vaccines, so we've supplied over 200,000 vaccines to places like St Helena and the Falkland Islands, and also to the Ministry of Health in Ukraine. For COVAX, we're working across Africa with Ministries of Health, working with Gavi and UNICEF, with a particular focus on Zimbabwe and the challenges of South Sudan that you've just mentioned.
Indeed, and we saw those pictures. I mean, what are the logistical and political challenges facing these types of deliveries?
Well, we've been working in these environments for over 180 years, and we currently work in 60 countries, but South Sudan is probably the most challenging. We transport drugs over 1,000 kilometres on hard-baked roads as it gets up to 50 degrees Celsius during the summer, but then it gets incredibly waterlogged during the rainy season. And I've seen whole articulated lorries lost in some of these mud craters, and you don't want to be camping in the bush in South Sudan with armed groups close by. So we use things like light aircraft and motorbikes to get to the most isolated communities across the country.
And we've just seen how only 1% of doses have been delivered so far. When do you think this scheme will really get fully underway?
Well, it has been a slow start, but it's great to hear that there are so many vaccines getting around the world. So there are, the vision of COVAX was to get 2 billion vaccines out across the world until the end of this year. Now, thankfully, over 30 countries in Africa have already received those vaccines, which is great, but we are expecting a very big ramp up in June. Now, that gives us time to really invest in the infrastructure, things like community health workers, things like transport and supply chains, so that we can really hit the ground running when that second phase of vaccines arrives in the middle of the year.
OK, so next gear in June, but when do you think the whole world could be vaccinated by?
Well, there are lots of predictions out there, as you can imagine. I think if everything goes right, we'll be doing well if we get the world vaccinated by the end of 2024. But I think we all realise that COVID-19 is probably going to be with us for a long time. We're going to need kind of jab top-ups, a bit like flu in the UK. But one of the things we're very concerned about is COVID-19 becoming a residual pandemic. And so in the same way that we don't really talk about HIV or AIDS across Western countries now, HIV and AIDS still kills 700,000 people across the world, and a lot of people in Africa as well. And we can't allow COVID-19 to go down that route.
Fergus Drake from Crown Agents there.